There's something rotten in the state of pharma. Greed, secrecy, inefficiency, it's all there. Hedge funds are regulated lightly based on the assumption that investors are sophisticated and can take care of themselves. That's largely because big pharmaceuticals have exerted political influence to avoid cost controls, to ban medical care from using its bargaining advantage to negotiate lower prices, and to allow drug companies to pay the manufacturers of generic drugs to delay their cheaper versions until they can make their money from their expensive versions. Most new drugs for cancer and rare diseases are being priced above $400,000 a year per patient. Some drugs are being priced at $1 million per treatment, and prices continue to soar. Meanwhile, the pharmaceutical industry is making a fortune off of average Americans, who are paying more for the drugs they need than the citizens of any other advanced country. In 2020, the pharmaceutical market is anticipated to more than double to $1.3 trillion United States dollars, with the E7 countries, Brazil, China, India, Indonesia, Mexico, Russia and Turkey, accounting around for 1/5 of global pharmaceutical sales. Further, incidence of chronic conditions in the developing world will increasingly resemble those of the developed world. Richter's report, entitled The Genome Revolution, issued on April 10, 2018 says, "The potential to deliver one-shot cures is one of the most attractive aspects of gene therapy, genetically engineered cell therapy and gene editing. However, such treatments offer a very different outlook with regard to recurring revenue versus chronic therapies. While this proposition carries tremendous value for patients and society, it could represent a challenge for genome medicine developers looking for sustained cash flow. This in simpler terms means that manufacturing medicine that actually cure the disease is not a viable business model for the pharmaceuticals, hence they need to only manufacture medication that helps to manage the disease so that patients' customers can be retained longer. If you become addicted to painkillers, there are pills to help you stop taking the pills, by reducing the symptoms of withdrawal. And if you take too many pills, there's a pill for that too. The drug and chemical industries do their part by providing pesticide-filled GMO corn and soy, fed mostly to dairy cows, and with most of their antibiotic products going to fatten up the animals most of us eat and fall sick. We have not reached the limits of scientific innovation. But we have reached the limits of common sense and common decency. This is even more reason for us to check what we eat. There is healing in nature, which is where most of these drugs are drawn from. Our food should be our medicine, and our medicine should be our food.